Hi everyone, welcome to Center of Balance. I'm Sunan Pua from Center of Balance, the acupuncturist. Well, today we're going to talk about acupoints for dizziness. So if you suffer from dizziness or vertigo, imbalance, please reply 1. Or if you know anyone who suffers from it, please reply 1 as well. Right. So let's go through what's dizziness. So dizziness is the feeling of being lightheaded, woozy, or unbalanced. So it affects the sensory organs, especially about it causes the eyes and the ears discomfort. So it can sometimes cause fainting. Dizziness isn't a disease. It is a symptom, okay, but rather a symptom of various disorder. Vertigo and this equilibrium may cause a feeling of dizziness. But those two terms describe a bit different symptoms from the dizziness. So vertigo is has a symptoms like spinning. You feel like spinning all around. It's a spinning sensation, like the room is actually moving. This is vertigo we talked about. It's a bit different with dizziness. And it may also feel like motion sickness, or as if you are learning to one side. You walk in and you go one side. That's called vertigo rather than dizziness. This equilibrium is a loss of balance, or we call it imbalance. So true dizziness is the feeling of lightheadedness or nearly fainting. That is what we call dizziness. But of course, they all link together. Dizziness, vertigo, imbalance. Pretty much similar. So dizziness is common and its underlying cause usually isn't serious. Occasional dizziness is not something to worry about. But however, you should call your doctor immediately. To go to see a doctor immediately if you are experiencing repeated episodes of dizziness for no apparent reasons or for a prolonged period of time. Now, of course, if you bend down and quickly getting up and you get a bit of dizziness, that's pretty normal for you, right? That's pretty normal, right? If that is just suddenly and occasionally it happened, if it happened all the time, then you may need to see a doctor. But I will tell you, most of the time you run all the tests, they say, oh, it's normal for you. But according to Chinese medicine, we can do something for it. We think this is blood deficiency in Chinese medicines. So we would suggest you take some herbs, Chinese herbs, of course. Okay. Today I'm going to show you, no matter what the reason is for dizziness, one of the very key thing is the blood is not going to your brain properly, go to soon enough to your brain. It could be blockage in your neck, tight in your neck, could be neck problem, could be mania disease, But anyhow, doesn't matter what the real causes, because sometimes it's very difficult to actually find out the cause, the problem. Then I'm going to show you some acupressure point. That acupressure point can help to reduce relieve the symptoms of dizziness, lightheadedness, okay, to bring more circulation, blood circulation into your brain, to your head, okay, so to prevent or to reduce dizziness. And it's very, very simple. Okay, now I'm going to show you right now. Nothing to do with your head, you know, we use distal acupressure points. Distal acupressure points. Yes, if you go to the previous video, I think last year while lockdown, I did some a local point to show everyone how to tap on the head. That helped dizziness. Okay, and today I'm going to show you some distal acupoints. Nothing to do in here, but it will help. The point over here correspond to your head, and it's very simple. So you want to do it from the wrist, right? Over here. Over here. So use your fingers and press over here. If there's tenderness, go for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then move. So we're going to do, in general, each point we do 30 seconds. But we're going to do a lot of points. So we down to about only 10 times, right? Over here. Between the first and second metacarpal bone. And on this point, it's close to the second metacarpal bone. Press it. If you feel tenderness spot, give it 10 seconds. Count to 10 rather than 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And move a little bit toward to your fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And move. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If there is no tenderness spot in here, just keep it. Don't worry about it. Okay? Go over here. And then go to between the second and the third metacarpal bone down to your wrist from here. Like me, in here, I don't have any tenderness spot. I move a little bit toward to the hands, your fingers. I move this down here. Yeah. And the soft part, nothing. For my case, a little bit in here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right? I don't know about you, but and then over here between the third and the fourth, go down to the wrist. Start from here and move. Okay? That's where you need to work on. Then over here between that one and that one, over here. Right? And the last part is over here. Go from here to here. Okay? So when you finish all this, that corresponds to your head. You want to do it even further? There's another one. Your fingers. With your fingers, go like this. 3 times each. Again, all these fingers, the meridian and the point correspond to your head. Very simple. So do it every day. Well, your dizziness may not happen all the time. If it happens all the time, you do it now. It may give you relief. Okay, very simple. This is in Chinese medicine. If you're an acupuncturist, it's simple. This is something that you can show your patient to do it. And for you, just go for any acupressure point. Stick a needle in there. The 3 yang meridian or 3 yin meridian. All the point from the wrist to here, because all this point over here, acupuncture point, correspond to the head. So you can do 3 yang meridian point from here to here, 3 yin meridian point from here to here, both hands. So one is in yang, one is in yin. So you needle that, all the point. Yes, a bit more needles, and then you get the patient lay there for about 15 minutes, 20 minutes, and it will create more circulation to the head, and they will actually reduce the dizziness and light headaches. It works very well. I try all the time. So you should do that. Okay? So if you're an acupuncturist, this is what you can do. But for you, you're not an acupuncturist, it's something that you can do when you go cover. You don't have to understand where the point, what meridian is it. You just go through it. If you have hit any sensitive point, sensitive tender spot, just give it a massage. That's it. All right. So stay awesome. And this is Friday. I in charge Friday live video, and my colleagues is going to in charge tomorrow, which is going to be Daisy. So Daisy is going to talk about acupoint for frequent urination tomorrow. Well, this is for women and men, right? This is huge topic. A lot of people have this problem. Yes, please. Tomorrow is the time, 9 o'clock New Zealand time. We'll see you tomorrow. Daisy will see you tomorrow, and all our video recorded actually on we'll upload to YouTube. And if you miss any of our topic, it's on Facebook. Every day on Facebook, you can find out, scroll down and look at the topic, or you can actually go to our YouTube to find the previous topic. Okay, so we are still open, COVID level 2. So if you need any help, come to us, contact us. We can see you. If you an overseas, if you not in Hamilton or not in Auckland, not in Raglan, because we have 3 clinics in there in New Zealand. If you are not near us, please leave a message down there or send us an email. We'll be able to do online consultations, and we can send you herbs, and or we can film tailor-made the video how to do acupressure point for you, and then so you can work from home. All right, that's it for today, and stay awesome, and I'll see you next time, next Friday. See you, bye bye.